We're at Southwest Spine and Sports, and today we're with Dr. Wolf. Tell me what kind of physicians you have here.
We are all physical medicine and rehabilitation physicians or physiatrists. All the doctors that work here are fellowship trained and specialize in musculoskeletal medicine. We do sports injuries and general musculoskeletal injuries, and we specialize in comprehensive non-surgical treatment.
Typically, what type of patients do you treat here?
We treat all sorts of patients, from young to old, from the weekend warrior to the professional athlete. And basically, just like our name says, we're sports and spine physicians. So we specialize in all sorts of injuries, from soft tissue injuries like sprains and strains to joint injuries like arthritis.
How do you typically treat your patients?
Basically, it starts with a very good physical exam and a history, and that helps us pinpoint a problem that they may have, and then we'll work our way into doing additional tests. It might be an X-ray, an MRI, an ultrasound that we do here in the office. Sometimes we do injections for both diagnostic and therapeutic benefit for them. That may include everything from injection in the elbow, such as tennis elbow, or an epidural in the back or neck, or joint for arthritis. And we're also doing some new alternative treatments that are all natural called platelet-rich plasma therapy, or PRP.
Can you elaborate a little bit more on this PRP, this new procedure?
Yes. PRP, or again, platelet-rich plasma therapy, is a technology that's really been around since the 70s, but became refined recently, and since then is becoming very popular in use. And basically what it is using the body to heal itself. I'm basically taking blood out of a person, about 60 cc's, and I'm spinning it down in a special centrifuge system 2 times. The first time, it separates whole blood from plasma. The second spin takes the plasma and it spins it and separates it from protein-rich and protein-poor. So in essence, I'm taking 60 cc's of blood and I'm spinning it down to a concentration of about 4 to 6 cc's of volume. And in that volume, you have platelets. Platelets are very rich in growth factors and other proteins. These growth factors and proteins can help to accelerate healing.
Is there research to support this new PRP procedure?
There is, and in fact, we're actively involved in it here at Southwest Spine and Sports. Research is really in its infancy. However, there are articles coming out that are positive. In our first 90 patients, we collected the information and analyzed it, and we found that about 70% of them were improved by at least 50%. So most of them are better. In fact, most of them were markedly better. And in that, we found less pain, improved function, and very good patient satisfaction, where most of them said they would do it again. The majority of patients only received one treatment, and only about 20 to 30% had a second treatment after about 10 to 12 weeks.
Thank you, Dr. Wolf. It's exciting that Southwest Spine and Sports is offering this new procedure for soft tissue injuries. So thank you for joining us today.
It's been my pleasure. Thank you.
Would I recommend this? I would definitely recommend it for anything that it is appropriate for. It won't help a bone problem, but for soft tissue things, definitely it definitely restores the function, and it's nothing foreign. It's putting your own stuff back in you, and you heal yourself, which is seems like the easiest way to go about it. No knives involved.
Make your appointment today with one of the best doctors in the Valley at Southwest Spine and Sports. Call 480-860-8998 or visit www.swspineandsports.com.